Working with Veterans, Part 2, Culture. In this module, we'll explore the culture of the armed forces to help us better understand the unique experiences of veterans and the challenges these pose when accessing services. Culture refers to the unwritten rules which guide and influence our behaviours. Culture is often learned during a veteran's formative years in the armed forces. Despite having left active service, many veterans still identify with the culture of the armed forces. We'll look at each of these 6 elements in more detail to explore their implications for clinical practice. It's important to recognise that the impact of armed forces culture is dependent on the length of time a veteran has served for. Using the examples of the brothers we introduced in Module 8, we can see that Michael has the least impact due to only having served for a brief time in the RAF. Simon, who served for 10 years in the Army, would have been impacted substantially by armed forces culture. And William, who served in the Navy for a full 22 years, would have experienced the greatest impact of armed forces culture. Hierarchy. There is a very strict hierarchy based on rank across all divisions of the armed forces. This provides a clear structure of authority and accountability. A veteran's previous rank within this hierarchy will have influenced how they were communicated to and how they communicated with others. For example, a veteran with a lower rank may see themselves as subordinate to others and will be used to conforming and following orders, whereas a veteran from a higher rank may expect respect and will be used to giving orders. These hierarchies have implications for clinical practice. For example, a veteran may view a clinician as senior or junior depending on their previous rank, and they may have expectations of how they should be addressed. A veteran's rank during their time in the armed forces impacts their perception of themselves and how they interact with those around them. William reached senior rank within the Navy and was responsible for commanding a ship of lower-ranking officers. Despite having retired from the Navy, William still communicates in a direct, formal fashion that could be mistaken for rudeness or aggression. William finds it difficult to share his feelings with the clinician as he sees them as being younger and less experienced than himself. A way to counter the implications of hierarchy in clinical practice is to develop collaborative, therapeutic relationships. Values. Each of the armed forces has its own set of values that revolve around common themes such as respect and discipline. These values help to guide the behaviour of new recruits. During service, these values become internalised, so when veterans leave the armed forces, they take these values with them into civilian life. These internalised values can have both positive and negative consequences for clinical work. For veterans, it can be distressing to return to civilian life where these values are not necessarily upheld. Veterans often hold high expectations of what they should be achieving. If veterans are unable to live up to these standards, it can lead to self-criticism. Veterans may well respect their clinician as a superior. This respect could be lost if a clinician goes against a veteran's values. Veterans will often be punctual and avoid missing appointments. On the other hand, the act of asking for help may go against the veteran's values and could result in feelings of shame. A veteran's values shape how they see themselves and the world around them. Simon has developed a strong sense of values during his time in the Army, especially around punctuality. He is used to being 5 minutes early, as that is considered being on time in the Army. When starting a new job that starts at 9 a.m, Simon will arrive promptly at 8:55 a.m. to be on time. If one of Simon's colleagues arrives at 9:05 a.m, Simon will become frustrated. To Simon, his colleague is 10 minutes late. Simon thinks his colleague doesn't take the job seriously. A way to overcome these challenges in clinical practice is to be aware of a veteran's values and to respect them, even if these values are different to your own. As we've seen, values can have both positive and negative implications. It's possible to work with a veteran's values to achieve positive outcomes. Collectivism. The armed forces foster a collectivist attitude. This revolves around being part of something bigger than yourself and coming together with a united purpose. Collectivism can have positive benefits, such as fostering loyalty and building camaraderie through shared experience. However, collectivism can also pose implications for clinical practice. It can lead to veterans minimising or neglecting their own needs, and by seeking help from services, veterans can feel selfish or undeserving. Many veterans feel a great sense of camaraderie through shared experience. Simon spent 10 years living, eating and working with the same group of people every day. They also went on tours together where they were all exposed to combat trauma. Because of these shared experiences, Simon felt comfortable sharing his feelings with this group. Now that Simon has left the army, he feels isolated. He's reluctant to share his stories and feelings with people outside of the army, as he thinks they won't understand him. Language and communication. The way that veterans communicate can be influenced by their time in the armed forces. They can be direct when speaking. This comes from giving or receiving direct orders, which are to the point and instructional. Veterans will often use clear, non-ambiguous language. This comes from being in potentially life-threatening situations where there is no room for ambiguity. A veteran may use banter as an expression of camaraderie. Banter is often used to forge strong bonds within the armed forces. Veterans may also use unique slang terms from their time in the armed forces, such as referring to a civilian as a civvy. A veteran's experiences in the armed forces can influence their language and communication style. During his time in the Navy, William went on 12 tours where he experienced combat. In these situations, he needed to take direct orders from his superiors and relay those orders quickly and efficiently to his colleagues. These experiences have impacted how William communicates. When speaking to a clinician, William is direct and impersonal. Our services need to be flexible to accommodate and acknowledge these differences in communication. Ensure the language you use is accessible, taking into consideration veterans who join the armed forces with low literacy skills, and, if in doubt, ask for clarity. In the armed forces, qualities traditionally seen as masculine, such as Stoicism, are promoted. Stoicism and masculinity. Stoicism is associated with strength and being in control. Within the armed forces, Stoicism is a necessity. It can help an individual remain calm and functional in life-threatening situations. Within armed forces culture, experiencing emotions is seen to be a non-masculine trait, and recruits are conditioned not to express emotion. The implication for clinical practice is that seeking help for mental health difficulties is seen as the opposite of Stoicism. There is a stigma around mental health difficulties. Many veterans interpret mental health difficulties as a weakness or failure. This can reduce a veteran's chances of seeking treatment. Stoicism is something that many veterans learn during their time in the armed forces. Michael is experiencing mental health difficulties after being medically discharged from the RAF. He's come to think that he's a failure for leaving the RAF early. Although Michael only spent a brief time in the RAF, his experience has influenced his attitudes towards mental health. Michael views getting help for his mental health difficulties as adding to his failures. Clinicians can normalise seeking help for mental health difficulties through praise and positive feedback. It's important during contact with veterans not to add to narratives of masculinity. Alcohol. Finally, it's important to recognise the role that alcohol plays in the armed forces. Alcohol has played a historic role in the armed forces culture, from being rationed to frontline troops, to being used to forge bonds with other recruits and for coping with stress. After leaving the forces, many veterans still use alcohol as a means of coping with difficult memories and avoiding emotional pain. Statistics show there are higher levels of alcohol use in the UK armed forces compared to the wider population. There is also a correlation of use with veterans experiencing mental health difficulties, such as PTSD. Alcohol is an aspect of armed forces culture that can continue into a veteran's life after they have left. Simon was used to drinking with his teammates in the army to both celebrate successes and to cope with stress after completing tours. Now that Simon has left the army, he feels isolated. He has trouble regulating his emotions as he feels that he has no one to talk to. Simon relies on alcohol as a coping mechanism. Clinicians need to be aware of the role that alcohol plays in the armed forces. Veterans can be supported by including substance misuse services in their care plan. In this module, we've looked at different aspects of culture in the armed forces, such as hierarchy, values, collectivism, language, stoicism, and alcohol. We've recognised the impact of culture is dependent on the amount of time served in the armed forces. And we've explored the implications of armed forces culture for clinical practice.